My favorite brain part is the amygdala. The amygdala is a roughly almond-shaped mass of gray matter inside each cerebral hemisphere, which is why it was named after the Greek word for almond. The amygdala is my favorite brain part because I'm especially interested in the long-term impact of repeated concussions and find the connections between concussions, brain function, and behavioral implications fascinating. The amygdala is located deep in the temporal lobes. It's near the hippocampus and hypothalamus. It's a paired structure in each side of the brain and part of the limbic system. It consists of about 13 nuclei and it communicates with other regions of the brain. The amygdala has many functions, but a few are emotional learning and behavior, especially controlling fear and learning fear, memory formation, and it attributes emotions to memories to help you remember them better, and it especially remembers emotional traumas. It also deals with aggression. Reactivity of the amygdala is a good predictor of aggression, and scientists found that surgically removing the amygdala reduces aggression in previously violent individuals. The amygdala also plays a role in social behavior. The basolateral part sends signals to the hippocampus that is able to then modulate social behaviors. When the amygdala is damaged, a few things can happen. There will be difficulty forming emotional memories and an overactive fear response, leading to interpreting many situations as threats and losing control over physical responses. There's also severe emotional sensitivity. When the amygdala is hyperactive, individuals feel anxious, overly aggressive, and overly irritable. When it's underactive, individuals feel little or no anxiety and have trouble recognizing emotions, especially fear. A famous case study on patient SM shows what an underactive amygdala looks like when there is damage to amygdala in both hemispheres. This patient had no visible motor, sensory, or cognitive deficits, and she was able to identify a series of facial expressions. She could also produce drawings of every facial expression. However, she could not identify the facial expressions showing fear, and she could not produce a drawing of a fearful expression. She claimed she did not know what a fearful face even looked like. This shows patient SM's amygdala damage up close, and you can see where the arrows pointing are where that damage is. The amygdala hijack was a term that came from the book Emotional Intelligence by Daniel Goleman in 1996. This is when the amygdala overrides the rational part of the brain and takes over the brain. This leads to immediate, overwhelming, and uncontrollable responses that are out of measure with the actual stimulus, giving emotional reactions such as crying, shouting, or freezing that may not be appropriate for the situation. To prevent an amygdala hijack, an individual must understand what things trigger the reaction and avoid them. And they can also use techniques like mindfulness that was developed by therapists. Now we'll explore the connection between CTE and the amygdala, especially focusing on the case of Aaron Hernandez. CTE is the abbreviation for chronic traumatic encephalopathy. It has 4 stages and is a progressive illness found in people, especially athletes, who have suffered from repeated concussions and other brain trauma. It is associated with dementia, mood changes, and aggression. The case of Aaron Hernandez. He was a promising football player and turned into a convicted murderer, later committing suicide in jail. There was severe damage to many parts of his brain, including the amygdala. He had one of the worst CTE cases in a young person. In the picture in the bottom left, you can see a normal 27-year-old's brain compared to Hernandez's deteriorating brain. Boston University's Anne McKee, the director of the CTE Center at BU, commented that she is not going to connect the dots between his behavioral difficulties in life, but the amygdala is involved in emotional regulation, emotional behavior, fear, and anxiety, and was severely affected in Aaron Hernandez. From this, it is possible to draw the conclusion that the amygdala damage may have played a role in his aggressive act of violence in murdering his friend. Similar to the Hernandez case is a study on limbic system volumes and associated neurocognitive functioning in former NFL players. Compared to the control group, former NFL players had a greater dysfunction in mood and behavior. The NFL group also had significantly reduced volumes in many parts of the brain, including the amygdala. The amygdala was very deteriorated in the NFL group compared to the control group. There were statistically significant correlations between volumes and neurobehavioral functioning. Future work still needs to be done for the implications of amygdala atrophy, but this study and Hernandez's case both show that amygdala damage can lead to neurobehavioral issues. The amygdala is a complex and interesting structure. It clearly plays a role in CTE and other brain injuries, and understanding the connections and correlations could help us better treat patients with severe brain injuries and repeated concussions and their behavioral difficulties and behavioral function.